Hi, my name is Dr. Justin McCormick, and I'm the Clinic Director of the Chronic Pain Center in Mill Creek. If you're watching this video right now, it's probably because you're frustrated about your chronic pain. Maybe it's getting worse, maybe it's progressing. You might be frustrated about all the medication that you're on right now, the side effects. Maybe your doctors want to increase your dose or put you on these different ones. Or maybe you're frustrated because you've been told you just have to learn to live with it. Some people online I know are watching because they've just been told they have this new condition or this new diagnosis that they're not very familiar with, and they're looking for the right doctor to help them fix this problem. But whatever the condition is that you're watching this right now, if you're suffering from fibromyalgia, chronic fatigue, or generalized chronic pain, then this video is for you. I've treated thousands of patients over the last 12 years for chronic pain, and we've gotten amazing results. I've seen patients who come in every day with no life. They can't work, they can't sleep, they can't go to social events, they can't plan family functions with their friends because they just don't know how bad their pain's going to be that day or if they're going to have a fibro flare-up. Patients who come into my office who can barely walk because their back pain is so bad or their leg pain is so bad. They can't sleep at night or they're in and out of sleep and then they crash throughout the day. I've seen patients who can barely finish a sentence because their fibro fog is so bad. And after treatment, these patients that I talk about, they're now living a normal life or maybe very near normal. So today I'll be talking about brain-based therapy, which is the treatment that we specialize in getting patients, like I've talked about, their normal life again. So there's a few things that I want you to know in this short video. First of all, fibromyalgia, it's not a muscle problem. It's not, a lot of people think, well, I have pain in my neck or pain in my shoulders, my back, or my legs, so it must be a muscle problem. So they go on to muscle relaxers or painkillers, or maybe they get epidural steroid injections, and all these do is just treat the symptom. And when the medication wears off, the pain's still there again, or maybe it's even worse. So the first thing is, it's not a muscle problem. Which leads me to my second thing, is that fibromyalgia is a neurological problem. It's neurogenic, which means it's a brain-based problem. It's brain pain, essentially. So I'm going to use this chart right here to just kind of help you understand a little bit about the cause of fibromyalgia. Now, I'm going to try not to confuse you, but I think it's important you understand. So this right here is a side view of the spinal cord. So right here is what we call the brain stem. The back of it's what we call the cerebellum. And this, where that little arrow is called the midbrain. Now what happens is, in these fibromyalgia patients, in almost everyone that I've studied or I've had a consultation with, there's some form of serious stress in that person's life. That stress, sometimes it's emotional, which maybe is from neglect or maybe it's from a history of abuse. Maybe it's chemical, some sort of drug or medication problem. And sometimes it's traumatic, which means maybe this whole thing started when they were in an auto accident or maybe a work injury. But whatever the stress was, it leads to an overabundant amount of a hormone that we call cortisol to be released into the body. Now the problem with cortisol is it's toxic to the back of the brain that we call the cerebellum. So what happens is it makes it function really bad. And in turn, to compensate, the midbrain starts to overfire. It starts to overreact. And when those signals go from the midbrain back into the body, it's overstimulated. So we end up with pain all over the body. Maybe it's in the shoulders one day, in the hip the next, in the back the next. Patients end up with migraine headaches or maybe tension headaches. They end up with an increased heart rate. They end up with dilated pupils, which means they may be very light sensitive. They'll end up with irritable bowel syndrome, which means they may be constipated one day and have diarrhea the next. They may have severe fibro fog, where, like I said, they can't even finish sentences or they can't think clearly anymore. So all these things, again, are derived from an overactive midbrain. So what we specialize in, brain-based therapy, the entire purpose of it is to slow down the overactive midbrain. So the treatment that we go through has several facets to encompass brain-based therapy. We focus on what's called fuel and activation. Now fuel we get from the food that we eat. So when you have a meal, your body breaks that down into what's called glucose, which is usable for your brain to have the fuel that it needs to function. One of the things that we're going to focus on, therefore, is getting you off of the things you may not know are toxic to your diet. We want to make sure we eliminate those things and then promote the things that you need in your diet. The other form of fuel is oxygen. Oxygen comes from the air that we breathe. In the atmosphere, it's about 20%. In our office, the treatment that we use is highly concentrated oxygen to 90%. So when you're undergoing a treatment in our office, you're getting essentially 4 times the amount of oxygen in our clinic as you would in the atmosphere. The other thing I spoke about was activation. Now for activation, we use laser therapy, which is amazing technology. It's designed to stimulate the nerves to work like they're supposed to. We also use a small device called an activator, where if we find nerves that are being pinched or compressed, you may be able to feel those sometimes, we stimulate those and activate them so that they start to function properly again. And these aren't painful. There's no pain. It's just a real easy procedure to get that nerve in the brain to start working right again. We'll also use what's called spinal decompression. Spinal decompression is amazing technology. In fact, a study that I just recently came across said that 95% of patients with fibromyalgia got substantial relief after undergoing a decompression treatment. Those are pretty good results. We'll also use what's called pharmaceutical supplements. So these aren't going to be the junk you find in the stores that are very low quality. We use the highest quality supplementation to lower inflammation in the body and to stimulate the brain and the body to heal like it's supposed to. So those are some of the different things that we do in our office. So if you're having any of these fibromyalgia problems that I've talked about, brain-based therapy may be the right option for you. So to find out if you're a candidate, call our office, ask for anybody there to set you up for a free consultation with me, and we'll do an evaluation, which will help us determine if you're a good candidate. And if you are, you'll actually get a trial visit. So that's where you get to come into our office. It's no charge. You just get to feel like what some of this treatment is like that I've been talking about. Below this page, you're going to see a lot of different video testimonials. These are just average patients that we see every day, and you can see the amazing transformations that they've had. They have a new life. They have a new lease on life, and these are the type of things that we see every day. I look forward to seeing you soon. Call our office, ask for that free consultation with me. We'll see if we can help you get your life back. Thank you very much.